High-functioning ADHD, why driven professionals fly under the radar. On paper, you are succeeding. You might be a leading executive, an advancing professional, or an ambitious student. You meet your deadlines, you achieve your targets, and to the outside world, you are highly capable. But behind closed doors, the reality is often very different. You may be relying on intense last-minute adrenaline rushes just to initiate tasks. You might be sacrificing your sleep, your health, and your personal relationships just to maintain the illusion of control. In psychiatry, we refer to this as masking, and for high-achieving adults with undiagnosed ADHD, the cost of masking over a lifetime is often profound exhaustion and executive burnout. Before we begin, please note that the insights in this video are strictly for educational purposes only and are not substitute for personalized medical advice. Today, we are going to explore why high-performing individuals so often fly under the radar during standard clinical assessments and why a more precise, comprehensive approach is vital for your long-term care and success. The diagnostic paradox. Attention deficit hyperactivity disorder is one of the most common psychiatric diagnoses in adults. This requires an exceptional detailed assessment. Yet, driven professionals are frequently misdiagnosed or completely overlooked. Why does this happen? First, we need to understand that the traditional picture of ADHD was built around observable childhood behaviors, inability to sit still. But in adults, particularly those with demanding careers, the presentation is vastly different. The hyperactivity often becomes internalized. It transforms to a relentless racing mind, a constant sense of inner restlessness, or an inability to simply switch off at the end of the day. The attention deficit rarely means you cannot focus. Rather, it means you cannot regulate your focus. Depends how demanding your day-to-day life is. This leads to exhausting cycles of intense hyperfocus on highly stimulating tasks, followed by complete cognitive paralysis when faced with mundane administrative tasks. Because your struggles are largely invisible to the outside world, the standard clinical system often fails to recognize them. The assessment quality. Now, this brings us to a significant flaw in standard healthcare pathways, which is the trap of a quick assessment. Highly intelligent and capable individuals naturally develop complex coping mechanisms. When you visit a healthcare provider, you may present exceptionally well. Because of this, pathways that rely on brief 45 to 90-minute assessments simply do not have the time to understand you as a person. When a clinician only has under an hour to assess a patient for ADHD, the subtle challenges of high-functioning ADHD are easily missed. Instead, the presenting symptoms such as chronic exhaustion, sleep disturbances, or chronic stress are often misdiagnosed as standalone depression or anxiety. While these conditions can certainly co-occur with ADHD, treating them in isolation without addressing the underlying executive dysfunction rarely leads to a long-term sustainable relief. You end up treating the symptoms rather than the underlying cause. Proper psychiatric care cannot be rushed. Making an accurate differential diagnosis requires a thorough understanding of the human mind, your physical health, and your unique environment. This is why, in my clinical practice, an initial ADHD assessment is a comprehensive up to 2.5-hour consultation. It is exclusively conducted by a consultant psychiatrist and never delegated. This extended time allows us to explore your complete history, your current lifestyle, your relationships, and, very important, your goals for the future. We look at the complete picture, the mind-body connection and beyond. Are there co-occurring sleep problems? How is your relationship with technology? Are you experiencing burnout from constantly compensating for your executive function? By taking a holistic, unhurried approach, we can definitely rule out other conditions and ensure that if an ADHD diagnosis is made, it is accurate, robust, and forms a solid, undeniable foundation for your care. Ultimately, the most important is for the individual to live well and achieve their goals sustainably. Once we understand your case, and if a diagnosis is confirmed, the next step is creating a personalized treatment plan. We understand if you prefer a non-medication approach. For some individuals, routine prescribing is simply not enough, particularly when you manage a complex, high-stakes life. The advantage of precision psychiatry is that we can utilize advanced clinical tools, and where preferable, we can also utilize DNA testing. This helps us understand exactly how your specific genetic makeup metabolizes different medications, guiding us towards the most effective options. Before medication, we look at specialist therapy, targeted lifestyle changes, and constructive use of technology. And crucially, we prioritize your privacy. In an era where healthcare is increasingly relying on automated systems, our clinic remains strictly human-handled. We operate with zero clinical AI note-taking and zero automated data processing. For professionals whose absolute discretion is paramount, your private medical information remains exactly the same, private. Living with undiagnosed ADHD can feel like navigating your career with an invisible weight tied to you. But with an accurate diagnosis and a personalized, evidence-based treatment plan, you can shift from surviving your workload to sustainably optimizing your potential. If this resonates with you, if this resonates with your experience and you are seeking expert, confidential support, you can find more details in the description below. Please remember, the goal is progress, not perfection. Thank you for watching and take care.